It is a difficult environment to operate in, just in behavioral health, physical health. There's barriers all the time, but we're finding ways to make sure our members are not the barriers to accessing that care.
Eric Kill and Jim Sharp are part of Pennsylvania's Delta Center for a Thriving Safety Net team, an initiative launched in 2018 with funding from the Robert Wood Johnson Foundation. JSI led a national Delta Center team, including strategic partners from the National Council for Mental Wellbeing, the National Association of Community Health Centers, and the Center for Accelerating Care Transformation. The goal was to advance policy change at the state and national levels and practice change among community health centers and community-based behavioral health organizations. Grantees used their Delta Center funding to support a broad array of policy activities, including background research, education and training, stakeholder engagement and convening, and building shared policy agendas. The Delta Center helped seed relationships that bloomed over time into powerful collaborations. Through funding by state associations and other sources, those collaborations led to significant policy victories and practice changes. Through their collaboration, the Rehabilitation and Community Providers Association and the Pennsylvania Association of Community Health Centers worked together to increase access to telehealth in the state.
It really fills that behavioral health gap. I think the most important thing we all learned, particularly in behavioral health, is we were having 10, 15, 20% no-show rates. That's gone down into single digits. It wasn't people were interested in getting the care. They had other factors that were impeding and impacting their ability to access that care.
Another focus for the team is health equity and how to eliminate health disparities.
As the Delta Center initiative pivoted during these the critical times when George Floyd was murdered, Delta Center said we're going to expand the lens of your project past telehealth and really how do we look at equity? How do we look at access? How do we look at diversity?
Deborah Riddick provided coaching from the Delta Center. She worked closely with the team to ensure their work makes a real impact.
They have stepped up to the challenge and they've been doing things like having conversations with the C-suites of all of their centers to talk about health equity. They've also done trainings of their members so that their members understand health equity and why their services are so important. And they are too also in the spaces where they have voids and gaps. They're working with community organizations to try to get some practice, to try to get some experience working with consumers.
Both associations now have gained a better understanding of organizational collaboration and look forward to spreading their knowledge.
Our hospitals across the state are struggling, and we're really trying to work with our hospital association based on the success we've had with RCPA to say how can we help fill some of those gaps? What are the challenges your members facing that we can help with, or vice versa? How can we help make sure our communities are a lot healthier?
And the next piece is really, how do we continue this partnership? Very interested. We've created a relationship, but we've also created a model of operation and a model of bringing together different entities to build. And I think that's one of the most exciting pieces to it.